Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, an overview of COPD exacerbations. When you have chronic obstructive pulmonary disease, COPD, you might experience occasional exacerbations, flare-ups. These episodes are characterized by a sudden worsening of symptoms including severe shortness of breath and a sense of chest tightness. /r/n/r/n When you experience a COPD exacerbation, you may need to use rapid-acting treatment, such as a bronchodilator inhaler. Sometimes, a COPD exacerbation requires urgent medical care or hospitalization. /r/n/r/n While exacerbations are often treatable, they can be dangerous. Having too many exacerbations worsens COPD. Preventing COPD flare-ups is an important part of living with this disease. /r/n/r/n This article covers what a COPD exacerbation is, what the COPD flare-up symptoms are, what causes a flare-up, and how COPD exacerbations are diagnosed. You'll learn not only how to treat COPD exacerbations, but also how to prevent them. /r/n/r/n A COPD exacerbation is a sudden worsening of COPD symptoms. Paying attention to how you feel on a normal day can help you recognize when a flare-up starts. /r/n/r/n Treating flare-ups as soon as they appear is important. Early treatment can shorten the length of the exacerbation and prevent the flare-up from becoming severe. /r/n/r/n COPD exacerbations are usually associated with a sense of distress, and the effects are more severe than the symptoms you normally experience when your condition is under control. /r/n/r/n Some people rarely experience COPD exacerbations, while others have frequent episodes. You may experience COPD symptoms like fatigue, wheezing, and exercise intolerance on a regular basis or even every day. /r/n/r/n Symptoms of a COPD exacerbation may include /r/n/r/n The symptoms of a COPD exacerbation can show up very quickly. You may notice them within hours or days. /r/n/r/n If your medical team has already given you instructions on how to manage mild COPD exacerbations at home, be sure to initiate treatment without delay. If you experience new symptoms or have not been specifically guided on how to handle symptoms on your own, get prompt medical attention. /r/n/r/n Sometimes, COPD exacerbations worsen gradually over a few days, but they can also seem very sudden, worsening within a few hours, even becoming fatal. It is important that you seek medical attention when you experience these symptoms. /r/n/r/n COPD is often described as an obstructive pulmonary disease. This is because the bronchi, airways, are partially blocked due to mucus, inflammation, and lung damage. /r/n/r/n When your lungs are already damaged from COPD, anything that furthers inflammation and mucus can challenge already compromised airways, constricting them and making it more difficult to breathe than usual. /r/n/r/n Some of the factors that can lead to an exacerbation include /r/n/r/n While anyone who has COPD can experience exacerbations, you are more likely to experience these episodes if you smoke, if you have severe COPD, and if you are not consistently using your medication. /r/n/r/n Stress, fatigue, lack of nutrition, and sleep deprivation can all make you prone to infections and COPD exacerbations as well. It's also possible to have a flare-up without a precipitating factor. /r/n/r/n A COPD exacerbation is often diagnosed based on the symptoms of worsening chest tightness and shortness of breath. Your medical team may give you instructions regarding when to use medication for a COPD exacerbation. /r/n/r/n You may be advised to count your breaths per minute or check your own oxygen level at home with the pulse oximeter. However, If your oxygen is normal but you still feel respiratory distress, your healthcare provider may recommend that you use your at-home treatment. /r/n/r/n In a medical care setting, you may have several tests to confirm a COPD exacerbation and to look for a cause. Diagnostic tests that you may need include /r/n/r/n Because COPD can differ from one individual to the next, you need to work with your healthcare provider to design a treatment plan appropriate to your condition and lifestyle. You might be able to manage your exacerbations with rescue bronchodilators, inhaled steroids, and/or oxygen supplementation at home. /r/n/r/n These medications are fast-acting, and they work by helping open the airway passages and reduce inflammation. /r/n/r/n There are cases, however, when COPD exacerbations can severely inhibit your breathing. When this happens, you might need emergency treatment in a hospital setting. /r/n/r/n Interventions often used in the treatment of a severe COPD exacerbation include /r/n/r/n Mechanical ventilation is a temporary intervention. You will be unable to speak while you are intubated, and your oxygen and carbon dioxide levels will be carefully monitored so your medical team can determine when it is safe to remove the breathing tube from your windpipe. /r/n/r/n If you have a bacterial lung infection, you will need antibiotics. These are prescription medications that kill bacteria. However, they are not effective for the treatment of viral or fungal lung infections. Viral infections usually improve without antimicrobial treatment and fungal infections are treated with antifungal therapy. /r/n/r/n If your healthcare provider prescribes an antibiotic for you, your symptoms may improve before your prescription is finished. Nevertheless, finish your whole dose so that you will not have a recurrence of a partially treated infection within a few weeks. /r/n/r/n Taking antibiotics when you do not have a bacterial infection can lead to problems such as aggressive antibiotic-resistant infections, so only do so when advised by your practitioner. /r/n/r/n Prevention is important if you are at risk of COPD exacerbations. Lifestyle strategies and medications can reduce infections and exposure to inhaled irritants. Taking your COPD medications can optimize your lung function, making you less susceptible to the effects of lung inflammation and mucus accumulation. /r/n/r/n Preventative strategies you can use to avoid a COPD exacerbation include /r/n/r/n Many people who have COPD can benefit from supervised rehabilitative techniques that include breathing exercises, pulmonary hygiene, and a physical exercise routine. You might also be advised to use pulmonary exercise equipment in your home. /r/n/r/n The idea of pulmonary rehabilitation is to maintain physical and pulmonary conditioning. This can optimize your lung function to prevent a decline in your respiratory abilities. /r/n/r/n A COPD exacerbation is a sudden worsening of COPD symptoms. COPD flare-up symptoms may include shortness of breath, chest tightness, and more difficulty breathing than normal. Severe COPD exacerbations require emergency medical treatment. /r/n/r/n COPD exacerbations can be treated and prevented. Talk to your healthcare provider if you're having flare-ups. Diagnostic tests can help providers determine the cause so you can get the right treatment. Implement healthy lifestyle strategies to get maximum benefits and help prevent flare-ups. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.